I was excited for the Langdon Community Collaborative meeting to get started. Corey and I had just met with a community member earlier that week who had offered to donate money for the multi-use basketball and tennis court. We had created the collaborative 4 years earlier with the goal of bringing nonprofits and community members together instead of doing our own thing. It felt good that people were noticing the work we were doing. The community garden and the quad baseball diamond project had been a huge success. After describing our conversation to the group, the ideas started to flow. What location would work? Who would build it? What grants could we apply for to match the money? What about the $20,000 we had received from the Alberta Healthy Communities Grant? We had started working on the assessments for that project a few months earlier, and it was overwhelming. The meetings were long, there was sticky notes everywhere, and I never knew if we truly answered the questions that were being asked. There was just so much to talk about. And I often left the meetings wondering, how is this even going to help us? We lived in the community. We had done the surveys and the needs assessments. We knew what was needed. In early 2020, we had received the results from our assessments. Physical activity, mental health, and sun protection were identified as key priorities. Then COVID happened. As the world shut down, everything we had learned about our community in the past 6 months became more noticeable. The kids would sit on the curb of Main Street to talk and hang out. The seniors set up camping chairs in the parking lot of grocery stores. The families were having campfires on their driveways. It became so clear to me why physical activity and mental health had been highlighted as our priorities. But we had limited outdoor space to support this. Our park in the center of town was just an empty, snowy field. A year later, with our HCAT and CCAT data, we were ready when the federal government created an investment opportunity that was meant to bring communities back together. We had been successful with a few smaller grants to get the multi-use courts built, but we didn't have the funding to do anything else with the empty field. Writing the application was difficult and included 3 months of questions and requests for data from the government. But we understood our why, and we had the data to back up our funding request. We found out later that we were one of the first community organizations in the country to receive this investment opportunity. Although we had received $20,000 from the Alberta Healthy Communities Initiative, the process we learned helped us fundraise another $1.2 million. That small basketball court idea has now turned into a complete revitalization of our Central Park, with 3 multi-use courts, a library and youth center space, an outdoor gathering garden, and 250 trees for shade in the summer. And most importantly, we have the tools we need to live healthy lives no matter what the world throws at us next. We can collect the data, find our why, and turn that into funding that meets our community's needs.